Welcome to the Growing Tall Poppies podcast. I'm your host, Dr Nat Green, and I'm so excited to have you join me as we discuss what it means to navigate your way through post-traumatic growth and not just survive, but to thrive after trauma. Through our podcast, we will explore ways for you to create a life filled with greater purpose, self-awareness, and a deep inner peace. Through integrating the many years of knowledge and professional experience, as well as the wisdom of those who have experienced trauma firsthand, we will combine psychology, accelerated approaches, coaching, and personal experience to assist you to learn, to grow, and to thrive. I hope to empower you to create deeper awareness and understanding and stronger connections with yourself and with others, whilst also paving the way for those who have experienced trauma and adversity to reduce their suffering and become the very best versions of themselves in order to thrive. Thank you so much for joining me on today's episode. I'm really excited today to bring you our next guest on the Growing Tall Poppies podcast. It's my absolute pleasure and privilege to welcome a very dear friend of mine who I've known for a little while, haven't I?
A little while.
Probably around
Close to 20 years.
20 years coming up, I think. And I'm really excited to introduce him to you today. We've done a bit of a different angle we're coming from today. I want to introduce my dear friend, Mr. Paul Watson.
Hey, guys. Hey, Nat.
Hey, Paul.
How are you?
Great.
Good to be here. Thank you.
Yeah, it's been a while working on getting this happening because I think what we're going to talk about today is really, really important and something that does not get spoken about enough. So Paul is going to do a bit of an introduction, but today is really around looking at it from the perspective of the carer and the person who's been a huge part of the journey of someone who's been through significant trauma and adversity. And I think we don't focus on their story enough. They're often, the focus is on the person going through the trauma, and now it's about really shining the light on the person and the family behind the trauma sufferer, because they also have significant trauma and a different angle to come from. So let's start with Paul. Tell us a little bit about you and what you do in the world.
Well, so to begin with, so Paul is my name, and I'm partner to Bron and dad of our 5 boys, Josh, Ben, Sam, Tom and Ollie. And the boys now range in age from 26 down to 16. And look, with what you're saying there, Nat, is about the focus. Sometimes you don't want the focus because there's enough going on as it is when it comes to helping, caring in particular with somebody who has going through, in our case, not 1, but 2 cancer diagnoses of the curable and non-curable kind. So that's why we're here today, is to have a conversation about that. And I'm open, I'm not apprehensive, but you don't talk about this sort of stuff too much, and I'm thinking, right, this is going to dig down into some of the nitty gritty, which is fine. It's good to be able to share some of that stuff, actually.
Yeah, and it's not lost on me what an honour it is to talk to you about this, because I know that you do wear your heart on your sleeve with a lot of things, but we don't really talk to you about this. You're the sort of person who says, I'm fine, all good, we can get through it. And positivity is absolutely essential when you're going through something like this. But I think it's also important.
There's a reality too. There can be quiet moments where you're absolutely wondering what the hell is going on, and not so much why is this going on, but what the heck is going on, and where am I in this what we call the vortex. You can call it fear, you can call it the cancer machine, but just the vortex.
Yeah, so let's go back. We'll set the scene a little bit for our listeners.
Which one? Which scene?
The scene or the listener? The one listener we've got that listens.
Yeah.
Got bad news for you, Paul. There's a lot more than one that listens.
All right.
And
Okay.
I think this is a really valuable, as I said, a valuable conversation. So let's go right back to pre-cancer being a big part of your life. So where were things at with you and Bron and the boys back then?
So 2016, which was the year before we'd been over in England, sorting a few things out over there. Overall, we were probably like a lot of people, just working hard, sometimes spending time wondering what the next plans were, making goals. They varied from running our own businesses to getting out of corporate world into our own thing, and there was things going on. Yeah, like everybody else, you're working with your family, you're spending time with the family, going through 5 teenage boys at the time. What's that? 9 years ago. So yeah, it's not a blur. It's actually very special times in life, and yeah, hanging out with family and friends and just doing what everybody else does, I think, is just doing life.
Yeah, and we often take that for granted, don't we?
Absolutely.
We just go through the motions. Sometimes we're doing work that we love. Sometimes we're just doing it and going through the motions, thinking, oh, yeah. And we don't really stop and think. We just do time with friends, time with family. And we know that family is absolutely of primary highest value for you guys. You've always been very family oriented. So you're just going through the motions, doing the do. And then let's fast forward to 2017 and what was happening then.
So 2017, we were dealing with a few things. We'd been away overseas in a family matter. Then we came back to another family matter, which was Bron's mum going through a diagnosis of dementia later stages. And recall Bron had a referral to get a mammogram and ultrasound done, and that had been put off by life events, things going on that you should be focusing on yourself, you're focusing on everybody else, as a mum often does. And I think it was this September where Bron decided to get this ultrasound and mammogram done, and had to push the GP at the time because she was sub 50 to get that done. And I do recall that quite clearly, the kerfuffle in ensuring that was done. Because in Australia, that's really sort of women 50 plus, that there's more of a focus on those routine checks and balances. And I do recall the day when Bron was off getting the ultrasound and mammogram done, and she'd insisted on getting it done. And I remember her having a dream that she had breast cancer. And after a physical examination from the GP, which didn't show anything, and Bron actually ensuring that she could get this thing done. And the GP's words were pretty much, if you've got cancer, I'll eat my shoe. And lo and behold, upon further examination and ultrasound, that there was definitely something there, and it was breast cancer. And so that was a big day, and going into the GP and sitting there and sitting alongside someone in my situation was caring about her, of course, not caring about me so much, because I thought, well, I'll get through this. Then thinking about how the heck do you talk to someone who's as young as 7 and through to the age of 17, roughly, the differences of how their mum has got breast cancer, and let alone the questions we had, the questions they would anticipate that they would have.
Yeah.
So thinking about that, and then, when you're a carer, dad and a father and a husband, you think about the financial things come into it, like how are we going to get through this, how are we going to do this, we've got commitments, we've got stuff. And so that was a big event. It's the best way to put it.
If I remember correctly, you were both in the business together. So everything relied on the two of you moving through it together.
Yeah, look, I was a big support factor and involved in various ways. Bron was very much front and center, and so it wasn't really my business, it was still Bron Watson. So that was all those things, like how are we going to do this? How do we get by? Because it wasn't a small lump, it was actually a very aggressive kind of cancer, a very immediate. I think within 5 days, Bron was on the operating table going through mastectomy. So things happen pretty quick, and you think it's going to be typical Paul Watson. It's going to be all okay. Everything's cool. Everything's going to be fine. It's like, holy hell, this is one heck of a roller coaster ride.
Yeah, and it was very much. And I know you've always been someone who's strong, looks at the positive, really forward focused, but there must have been moments where you thought, holy shit, how are we going to get through this?
Yeah, you're looking, you do unfortunately have to look at what does life insurance look like, and what does income protection insurance look like, what if there is any. In this case there wasn't, but yeah, big note on that we can chat about.
Yeah,
but
definitely.
recommending people look at that sort of stuff very, very carefully, and what sort of policies and things they've got, because you don't expect these things to happen to you, especially when Bron never smoked, never drank, never, didn't do anything that leads ordinarily to these sorts of things being exacerbated. So yeah, those realities kick in, and you do think, wow, this woman has had in some respects, an expiry date handed to her, because that's what the things that get discussed. Fortunate to be still sitting here
absolutely,
and still sitting here. Yeah.
But I think they're very real thoughts that we can't pretend that you can stay focused and positive all the time. There has got to be times where those thoughts do creep in, and that extra pressure for you to stay really strong for your partner.
Yeah.
Because they're facing it and you're trying to carry the load of Bron's emotions, as well as all the boys, as well as your own.
Yes. And I think, people would often ask how, because Bron, well, anybody who knows Bron knows that she doesn't answer her mobile at the best of times. I call her mobile stationary. But it was like, can you please make sure that you handle calls, messages, and Facebook and all the different things. So yeah, that became me, affectionately nicknamed Uber. Uber became Uber A to Z. So Uber, everything from washing, like any partner would do in most cases, I would think, but everything from washing to cleaning to driving to taxiing to administration to
everything.
Calls. Uber, everything. And Uber has stuck. And that's the nickname.
Yeah. I should have affectionately introduced you as Paul Uber Watson, your middle name.
Yeah.
But the reality is we laugh at that now, but you very much picked up the load because Bron was so unwell with her treatment.
Yeah, it was extensive treatment, and what the system sort of deals out, any woman would know who's been through the same thing, like every woman, and even men with breast cancer too, of course. Can't deny that, but yeah, everybody reacts differently. But in her case, it was pretty severe treatment for an aggressive breast cancer.
And then there was the added complication, if I remember correctly, of her being allergic to some of the things in the chemotherapy. So she had allergic reactions.
Correct. Yeah.
And was very, very unwell.
About maybe 20 to 25% of the treatment couldn't be completed because of the reactions to it. Yeah, very severe.
So that was a long road, a long journey, and a lot of things changed, didn't they? You sold your house, moved into a rental, taking the pressure off in a lot of ways.
Yeah, it was time to do a few things. We, I guess, financially made some different decisions that were affected by things that we were doing for the family. And so it meant, freeing up, like most people, or a lot of people have got their equities tied up in their homes and access to a lot of cash. So we made a change and bought some land, and that land got sold pretty much straight away because Bron couldn't choose a doorknob, let alone a colour selection. So we offloaded that, rented for a while, and then we've sort of changed a few things since then. But yeah, that was 2018.
Then things smoothed out for a while, didn't they? She worked through that treatment. Yeah, things were going quite well. She bounced back very well.
Yeah. Like in the business, Bron's business did very, very well. We both got into that with me supporting her, of course, and because it's always been about primarily women in business. So it's been helped. Yeah, the business went very well for some time. She got involved in some overseas groups, and I don't know how she did it, but she did it and kicked on, and really, because back to income and protection insurance, there was no insurance. So it was, some people have the access to that, which has been set up earlier on in life. And that's something that we recommend that women and men, if you're of a certain age, you can absolutely look at your insurances. If you do have superannuation, you can speak to your broker or go into MyGov. And this is not financial advice, but definitely go and have a look at what you do have access to. And if you have superannuation, it pays to find out through the superannuation company what insurances are sitting inside your superannuation that you might be able to turn on or access prior to any traumatic events like that people go through. So it's definitely worth, if you've got commitments like mortgages and kids' education and those kinds of things, it's definitely worth having a look at.
Because absolutely, that was one of your biggest lessons
from a
practical point of view.
Big lesson.
That put so much extra pressure on you guys because you had to keep going. There wasn't the capacity to stop.
Nope.
I remember Bron would have her treatment and just keep going and turn up, and she'd race to the toilet to be sick and then come back, and she'd just keep going with your support.
She was running Facebook workshops with a turban on mid chemo.
She's phenomenal. So again, things were traveling along quite nicely. And then do you want to share what happened next?
In 2022?
Yeah.
So 5 years goes by, which is your typical period where if there's no signs of any cancer, it's classed as remission. So despite there being a few little complications in terms of the way that came about with the lack of scans and things, it still reached a point which was excellent in about October 2022, where a wonderful specialist who we were dealing with, she said, look, great. I remember being in the car, got the phone call, Bron, you are technically in remission. So it was like, yeehaw, no more breast cancer, still on medications to anti-blockers and that sort of stuff, which is quite normal. And so this wonderful GP that Bron has, Dr. Casey, so from memory, it was a niggling blood marker that Casey was really unsure about, and took the extra steps from a diagnostic perspective to say, look, I think we need to refer this to a hematologist. And so she did. So that was I think that was the December. In January, we trot off to the local hematologist, and it was a lovely guy. And I sat down and with the results and looked at us both and said, look, everything's good. You can get on with it. I think he said, well, I'll see you in 12 months' time for a follow-up. And so I trotted off to Sydney to go and do a few things, and Bron stayed in Port Macquarie. And I remember being in a cafe in Burwood, and this was 4 days later, and Bron's voice was shaky and clearly had taken a hit. And I'm like, what is going on? What's happening? And all she said was, I've just had a phone call from the specialist, and 2 results have come back that we wasn't expecting to come back in an abnormal fashion. And we've got to go and see him straight away. And I said, well, what do you think? What's going on? And she said, look, he's talking about multiple myeloma. He was talking about blood cancer. He was talking about, which these doctors, God bless them, but emotional intelligence is not on the top of their attribute list. But so he would have sounded like it was just rattling off out of a textbook, is what it sounded like to me. That's how it sounds. And so needless to say, whatever I was doing, I cut that short, jumped in the car and drove straight back to Port Macquarie. Felt like the longest 4 hours in the car ever. And we went down the path of going through the beginnings of understanding what multiple myeloma is and bone marrow cancer and treatments. And it was so surreal, actually. I can still very feel that rawness now of just, you can't believe that you're in that again. In that again.
And knowing that you just had this most euphoric period of, she's all good, we're clear, we've survived it. And
4
then
days
bang,
ago, we were both told everything's fine. Don't want to see you again. Those are the words. We don't want to see you again.
And I still remember having a conversation with you and how raw it was, and we're like, what? how could he say everything was fine and then bang, oh, he read it wrong or something? So let's go back to that time. And I know it's still really raw, but I think the listeners need to know what it's really like. What was that like? Not how Bron was feeling, how you were feeling.
Look, there's two things going on at the same time. You're in free fall because you think you might know cancer with breast cancer. Bone, blood-related cancer is a whole different world. And the serious nature of bone marrow and multiple myeloma, you dare not Google it. Googling it, you would pack up and disappear.
Yeah.
You would never come back.
Googling wasn't our greatest
Googling,
moment, was it?
No. Googling is not recommended. But multiple myeloma is basically, I learnt that it is, so this, back to two things, probably three things going on. There's three sort of, the way my mind works is there's three sort of, I guess, horizons, if you like, best way to put it. The first one is the fact that it's surreal and you're stuck in this vortex once again, being shunted around like a pawn on a chessboard and wondering when you're going to get taken out or something. And then the next one is like keeping control of your emotions or your behavior triggered by the emotions, because we've done a lot of work in that space, and it's very, very helpful to, where I go to is gratitude the whole time. I'm grateful for all different kinds of things. And sometimes you're gripping onto the smallest little thing, like I've got fuel in my car. I'm grateful for that today, because the thought of going to the servo to fill up just can't process it. In those times,
doing that normal day-to-day stuff when nothing was normal in your life then. Yeah.
And then once again, having to face the boys and your family members, and that people are going to be coming forward saying, whatever we can do, let us know we can do it. And you're thinking, I don't even know what I'm doing, let alone I don't know what you can do. Want. You don't want to appear rude, but it's like, oh man, just leave me be. Don't sort this mess out. And that's where I go to. And so the third one is, all right, well, what can we do? What is going on? How are we going to get through this? I know it's an incurable cancer. We've been told that, the life expectancy is X, Y, Z. And in my mind, myeloma typically is diagnosed when you don't know you've actually got it.
Yes.
It's a bit like pancreatic cancer. Unfortunately, it's too late. And once again, back to our amazing Dr. Casey, if she hadn't have done what she'd done, we wouldn't have known, and it would have been what they call smouldering, and a severely smouldering case. And then, when you lean over and then you crack a rib, you wonder what's going on. It's well advanced. So for me, it was hanging on to, and I still hang on to, the fact that Bron is mid-50s and not mid-60s or mid-70s, where the data
it's not as good. Absolutely.
It's not as good, and the bell curve of statistics tells you that the data that they do have, which is still limited currently in Australia, that may not apply as much to our situation. So you sort of hang on to that, but it's freaking scary.
Absolutely. And I think, if we're going to be open and honest, that it can't not be scary.
No.
There's this unknown, this huge fear, and you're left thinking, well, what's next? What treatment is there? And so much of treatment for multiple myeloma is unknown, isn't it?
It's very
trials.
Much trial land. Yeah. And so, you're back. So Bron went back into a world of a lot of chemotherapy, chemo in the home. Our boys experiencing that at a young age, and they would be shitting themselves. Like they literally would be, at the time, because I was. And I know Bron was, but at the end of the day, like, you're in this together, and what's that saying? You don't know how strong you are until you have no choice.
Yeah. And I think that was very much the motto that we spoke about a lot, wasn't it? That you really don't know how strong you are until that's the only option.
You've got no choice.
So you keep going and you keep going.
Yeah.
Because as Bron and you have always said,
yeah,
the alternative is not something you want to entertain.
Yeah. And I really feel for people who don't have, like we had and have an amazing community around us. People would be ringing up and doing things. And I said before that you feel like being left alone, but of course, I responded to every single message and every single phone call and made phone calls. And then when food started coming by, and it's like, oh my God, I got to get another freezer because there's not
exactly.
Our friends like you guys and friends, the Charlene's of the world and Gwenda's of the world, and your parents and your family. Like, there's loads of support, and I feel for people who don't have that around them. Maybe they don't know because they don't know, I guess. But I really feel for people who, in two respects, that don't have or aren't able to access information the way we've been able to access information because of the way we've been, I guess, educated or raised. And I feel for people who don't have, they might be in remote locations who don't have that, the people around them. That would be really tough.
And, talking about remote locations, we also need to mention here as well that we're in a regional area.
Very much regional.
So the treatment is not always available in regional remote areas. Sometimes you have to go to the bigger cities, which places more pressure. Like, I know you've had to do a number of significant trips, particularly, was it last year? Treatment, the big transplant, or was it the year before?
The transplant was in 2023.
So we're 2 years now.
That was in Sydney.
Which means packing up life as you know it, being separate from the boys, having to go down there, be isolated because for the treatment that you needed to have, Bron had to be completely isolated. And that put a lot of pressure on a family having to be in different locations, didn't it?
Best part of a month out of the home, best part of a month, Bron being at Prince of Wales. And I dragged the caravan, lucky to have a caravan, and dragged it down to Narrabeen because it was the only place I could get into for that long. So that's okay. You do what you do. And there's some lonely old nights in the caravan wondering what the heck is going on when there's literally nobody around. You're getting back late at night and then leaving at 5:30 the next morning, and to get through the traffic to get to whatever was going on the next day. And whilst very fortunate to be in a caravan at Narrabeen, a nice place, but it was middle of winter, but you got no one around. You really pretty much, got through a bit of Candy Crush.
Good old Candy Crush. But the reality was, at night, it's a very lonely place and a lot of thinking and overthinking about what was happening and how on earth you were going to cope. And so just explain what Bron actually went through then and the impact it had on you.
Well, prior to the actual physical transplant, there's a series of visits to Prince of Wales where chemotherapy has been administered to the point where the bone marrow or the blood generation system has been depleted, and all that's left is the baby cells, or what they call the marrow cells. And so then a centrifuge is attached to Bron, and they extract as many baby cells as they possibly can. In her case, I think they extracted was 4.2 million, and they were looking for more than that.
They wanted more, didn't they?
Because you only get one shot at that process in current treatment. And that was enough, which there was some argy-bargy around whether it was enough or not. And we were told that it wasn't enough. That was pretty devastating because you only get one shot and one transplant. But then we got a phone call the next day. Thank you, universe, that we actually had enough. Bron had enough for 2 transplants. So on they go on the ice, down to a minus 193.7 Celsius to be exact.
Wow. And
then you come home. They go on ice, you come home for some more chemotherapy, and then you go back and you have a dose of what's called Malphilan. That's when you go down for the month. And the Malphilan is a dose that's administered. It is a timed administration of chemo, like the mother of all chemos. And Bron I think she had to take I think it was like 6 or 7 icy poles and ice, because the ulceration to your entire gastrointestinal tract is
burned
severe.
it, didn't it? It burned it
Burned
so
all the
severely
way
that it
from
ulcerated.
your mouth to the
Other end.
never. But yeah, so here I am watching all of this, thinking normally, like, you want to be in control and being able to fix things, and you just can't. You're literally at the mercy of these guys and technology, thank goodness. And you're getting phone calls from what I affectionately call the woo-woos, which is like kale smoothies and ground up almond kernels and things. And it's like, you know what, you got no time for that stuff when you're in the middle of this thing.
No.
It's like, thank you for all that information. That's great. And get on with what's going on. So Malphalan gets administered. I think it's 20 minutes prior to, or you get 20-minute gap between the Malphalan and then when the frozen baby stem cells get minus 193.7, they come down to 37 degrees Celsius. I think it was about 3 minutes.
Okay.
Which was incredible. And then they administer the baby stem cells
through the drip
20 minutes after the Malphalan's been administered. So the idea is the Malphalan goes through, doesn't take out the baby stem cells, wipes out whatever's ahead of the stem cells coming in, and then all hell breaks loose in terms of the system having to accept its own stem cells back in again. And that's why you're there for about a month in total for that entire process.
Because basically they kill off absolutely all the person's immunity.
Everything's
Bron
gone.
It killed off everything, like every immunization, everything that she'd ever built up immunity to was gone in one go, wasn't
all
it?
Vaccines, immunizations from when she was a kid gets wiped out.
And her ability to fight any infection is gone. It's zero.
It's gone. Yeah. So you're pretty much like a quarantine ward.
Little bubble, wasn't it? Really?
Almost. Yeah. And so I'll be hung on for that ride. Boys couldn't come. No one could visit except for myself. I had to obviously do all the right things and wear masks and make sure that I wasn't going anywhere either. So
you were isolated to do everything you could to protect.
Did all the shopping before all that stuff, and it was just me in the van and Bron.
Yeah. So then you got through that.
I remember picking up Bron, and we went to go back to the caravan, and we said, I think we should just go home. So I don't know how she did it, but we packed up. We have a bit of a routine of the inside and the outside crew. Bronnie, she was happy to be the inside crew that day, and we hooked up and we got home, didn't tell the boys, and rocked up on the doorstep, and our beautiful friend Susan from Melbourne had been up, and Nikki had done a bit of change of the guard. And looking after Ollie and at that time Tom to stick him around, taking care of the guys whilst we were taking care of each other.
And I think you've touched on a number of things that are really, really important. Is your relationship, so supporting each other, communicating and being able to talk through the hard stuff and not avoiding those conversations.
No, nothing gets left. It's a bit like you hear of families where the kids come along, and then when the kids leave, the parents don't know what to do.
No, they've got nothing left. They've given everything to the kids.
They haven't talked for that long. Whereas we're a bit the opposite. We don't shut up the entire time to the point where it's like you're yapping.
Uber, go away.
Uber, you're yapping. Or it's like, Bron, you're yapping, like, can you just shut up for a minute, but that's all said in some kind of jest. But no, the discussions, you need to have those tough discussions, like things like what happens if this doesn't go the way we want it to go? What happens if, all these and you go through, and it's really important that you have, if you're thinking something, obviously find the right time to say it, find the right time to say it.
So communication and really talking during the relationship. And you also touched on community. So the importance and the power of community is so important. And we've learnt that through lots of our guest interviews throughout the year that we've been podcasting now, that's one thing that everyone says is really important.
Learn how to accept help.
Yeah, definitely.
Don't be too
proud
to accept the help. And it doesn't mean you failed. It means you've actually succeeded, because, it's that gratitude thing again. Some people may not get the chance to help others, and then when they are close to someone, they get the chance to help. It could really help them too.
Absolutely.
And you're actually helping somebody else by accepting help. Yeah. That's the key to this stuff. You got to look for the good things all the way through, not just coating stuff in sugar for the sake of coating stuff in sugar, but and there's no point in dressing up a turd.
Love it. I think you would say that on the podcast. I love it.
But it really is. If you can find, and when you can find that what
still laughing. Only you can say that.
Well, you got to say it how it is, right? But,
exactly.
And that's the key to this stuff, I think, is, during breast cancer, I don't think I was definitely not that great at accepting help. No. And you burn yourself out by thinking you can do it all yourself. And that's just ridiculous, because if you can't be the best version of you, how can you be the best version for someone else?
Yeah.
If you're not the best version of yourself for yourself.
Absolutely. And I think that's a really hard lesson, isn't it? That as people who work in helping professions, like Bron's background is a nurse, and you've always been someone who gives to other people, and that's just how you are and how we are.
Done a lot over the years for charities and communities, and always somehow doing something for someone where we can.
And I think that you also have to look after yourself, that there comes a time where often helping professionals and allied health professionals really give so much to other people that they forget about themselves. So that's been a big learning, hasn't it, for both of you?
Yeah.
That you've had to take the time to actually also look after yourselves.
Yeah. Yeah. Look, it's something that we talk to our boys about all the time as well, is that it's not selfish. It's not about being selfish. It's about being aware of what you might need. It doesn't mean going to the gym necessarily. It might be gym for the brain, like
absolutely.
It might be just
anything.
Yeah, talking to someone. If you feel like you need to speak to someone, go and speak to someone. If it's a friend, or if you haven't got a friend, if it's a therapist or whatever it is, don't be too proud to tap into what you might need.
And I think that's gold. That's a little gold nugget there, that don't be too proud. It's okay to ask for help. No, human beings were not born to be isolated and do things themselves.
Yeah.
They like connection.
Yeah.
It's about connection, community.
Yeah.
So one other question for you, Paul, is how would you say the overall experience of all the adversity and trauma you guys have been through, how do you think it's changed your outlook on life, relationships, your values?
That's a good question. I was probably a bit of a people pleaser for a long time. And that gets you nowhere, basically. It's about really being true to, if you've got a value, and that value is, for example, trust, or it's honesty, or it's, I won't be spoken to in a derogatory manner by someone who might be a friend, for example, a so-called friend. Really, it doesn't mean you've got to go off your brain and tell them what you think. It's like you just might disassociate yourself or distance yourself, and make sure that you're focusing on people around you who do love you. That's a big one. I've just distanced myself diplomatically, friendly from people who I believe don't really care or aren't prepared to share or whatever.
So really it's put things in perspective.
Yeah.
It's very much shown you what's important, what matters.
Yeah.
And
if you want to go and do something, and if you have the means to do it,
do it while you can.
Go and do it. Doesn't mean you've got to have cancer.
No, exactly.
Go and do it. I know that in terms of really, if you are thinking about what the reason why I'm pausing is because some people think they've got to have a lot of money or they've got to have been a certain profession to go and get help, right? It's not true.
No, it's not.
And I'm talking about learning, if you have a level of awareness around your emotions, right? I think emotions are going to happen no matter what. And we're all different, right? Trauma, which we've been talking about here today, trauma, what may be more traumatic for you may not be as traumatic for me.
No,
and vice versa, right? Because of our conditioning and our
life experiences
and knowledge, and that's putting things in practice. But one thing I do know, I believe, is that you can't control emotion, right? Emotions are going to come. They're going to come through because they've been triggered or they've been whatever they're going to do. But what we can control is our behaviour, and I believe we can control behaviour. And one of my favourite things to do is just to, when I've had something hit, like an emotional cocktail turn up, I like to work on. It's a work in progress every single day of pausing once that hit takes place before I react, before I think, right, that was a decent hit. Sometimes it's too late. You just go blah, and you break down, or you fire up, or you whatever. And I believe if you can just have the time to give yourself that minute, it might feel like an hour, but it might only be 30 seconds or 10 seconds might feel like an hour.
So that pause and that acknowledging your emotions.
Pause and go, right, how do I want to behave? And I think that is like a self-regulation, and it is a really good tool in my personal tool belt to help stop those massive peaks and troughs and just try and get some sort of mediocre emotional behavioral thing going on, so I can at least handle what's coming my way. Because when you've got 5 boys and a bunch of friends and you got your parents aging parents and aging friends and the stuff that it's life doing life. So it doesn't have to be triggered by this sort of stuff, but when this stuff comes along, though, it ramps up that volume.
Absolutely. And it's about, and no one can ever be prepared, certainly not for a breast cancer and then a multiple myeloma diagnosis, but it's around looking at, what can I control?
And don't be afraid to cry. Like, if you want to have a cry, have a cry. That's okay.
It is. I love that you shared that very openly, because that's the reality.
I've had some big cries. I've had some big, oh my God, look at what. I never really asked the question why, because none of us know why. But it's not a silly question, but it's a very good question. But I don't give it any time. But yeah, mate, when some of those things hit, it's like, let it out.
I love that so much.
It takes a while. That's fine.
And if you go quiet for a few days or a week, that might be the time that you've taken to let those emotions process to that. It's like these little layers of an onion, and you never know when the next layer is ready to peel back, do you?
Yeah, no, you don't. That's it.
So if you look back at all the things that you've learned over these, through your whole life, because life happens and there's been ups and downs throughout, but particularly with things that have gone on for Bron and the boys, what would you say some of the key attributes or personality traits or anything that you think have helped you get through from trauma into post-traumatic growth and a level of coping that you're at now?
Wow, that's a really complex question in a lot of ways if you think about it. There's attributes that you have, or strengths you have naturally. Right. And everyone's got their own strengths, and I think Linda will love me saying this. But I think, and everyone's got their own, and they need to be lent into, because they're all cool in their own way. I'd probably go back to being willing to learn more about myself and being open to, sometimes it's criticism and it might be dealt in a really bad way, but sometimes there's some truth in that too, right? And you take little snippets of life, of things that you've learned, and go, well, I'll use that and I'll use that and I'll use that. And that's what I do.
Yeah.
I don't think it's about resilience. I think that's a bit of an overused term. Geez, you're so strong. Like, well, I don't know what that means.
Because, well, you feel like you haven't got a choice. It's either be strong or
and I say that, and I've had mates say to me, good mates, and I respect them for it, saying, I would not like to be in your situation. I much prefer my situation right now. And so I think by way of attributes to cope, everyone's got their own ways to cope. I definitely relied on alcohol too much. That was something that I lent on. It wasn't like binging to the point where I was blind every night, but I certainly drank too much alcohol.
And that was to manage the stress of everything.
That's because I felt that I needed it. You know, by the way, it tastes great. But no, all jokes aside, that was something that looking back, I would love to not have the time again. But if I did have that time again, I would love to see how I would have done without that. You know, like probably have a clearer head, and would I have said things differently? I don't know. I could still drive a car every morning, but could I have driven a car every night?
No,
probably not.
But again, that's a learning that as you look back, you can go, I may have done that differently. But again, self-development and that being prepared to learn everything you can to be the best version of you to help Bron, the boys, but also to help you navigate a really challenging, shitty path, let's be honest.
Yeah. I think I don't know. The truth is, I think for me, you could use it as an excuse. Oh, I'll have a drink because I'm stressed out. You know, like it's so easy to say that. People go, oh, well, I'd be drinking the whole bottle, not 2 glasses. You think, oh, there you go. There's my ticket of approval.
Yeah,
ticket of permission.
Yeah. So now I know that there's still a path ahead and you're navigating that as best you can. But I also know that you've made some big decisions around, you know, going on family trips and making the most of things while ever you can and living life to the full every day, haven't you? That's been something that's a very conscious decision for you guys.
Totally. Yeah, it's if you think you can do it and if you think you want to go and do it, my recommendation is go and do it. Like just go. If you want to go around Australia and put your stuff into storage and lease your property out or cancel your lease, or if you've got skill sets and you've got trades or you can work the way around the country, you just got to jump on some of those Facebook groups. And I know people who are living in Cairns right now who he tiled his way around and then learnt other skill sets and tiled his way. And I think his partner is a bookkeeper or accountant and she got jobs here or there. These days, since the pandemic, you know, people can work from, sometimes people can't. I get that.
Yeah.
But at the end of the day, if you think you want to go and do something, whether it's changing a job, whether it's telling your boss to go and get and, you know, changing jobs, go and do it.
So that's one of the biggest lessons in this has been
go and do it.
Do whatever you want to do, go and do it now while you can.
Do it. Yeah.
Make the most of it.
Yeah.
What's Bron's mug say?
Make every day count.
Absolutely. And I think that is something that will always stick in my mind. I've always loved it when she said that, make every day count.
Make every day count. Make every moment count.
Absolutely. So I'd love for you, Paul, to let us know, because you've got some pretty exciting things that you and Bron have got in the pipeline right now. What are you working on right now and where could our listeners find out a bit more?
Well, if there's so out of all of this, as a carer, you're sitting by watching a lot, and even the doctors and the specialists, when you pipe up in the meeting, it's like, well, you're not my patient. That's my patient over there. And they do tend to, until you sort of might build a bit of a relationship with someone, but they still tend to listen to the patient, even though I believe we're all like we're the patient.
You're the patients.
You're the patients.
Absolutely.
I can guarantee you right now, your partner who might be or friend, whoever it is that you're helping in these situations, might be going through. When you're in that room listening to that specialist at any time, I can guarantee you're not going to hear everything.
Absolutely.
Unless you record the whole thing. And I doubt that would be allowed. So on the eyes and ears, as well as Bron in our situation. So when you're in the little room after being told the news of, in this case, 2 lots of cancers, one curable, one incurable, and you're looking around and all you're seeing is like typical New South Wales government issued furniture. There might be a picture of a tree on the wall or a print. There's a cabinet full of red books, which is what you get given, that talks about all of your treatment and reporting and all the stuff and the things. It'd be great if there was another set of books in there, like little pink books or blue books or some different color, that says that it doesn't just have to be this red book. And so Bron's got this, she calls it a movement. I think I call it a movement as well, where it would be really cool to be able to, it's called the Serenity Project.
Yeah, I love this so much. So tell us about the Serenity Project.
My take on the Serenity Project is a bit about what I've been talking about today, is that you don't, whilst you're in a system, and you, in an ideal world, it'd be like, look, we found this cancer and we're going to park it for a bit. It's not going to go away, but we're going to park it, and we're going to give you a choice. And your choice is you can do a number of things. You can go through chemo, you can go through radio, you can have a mastectomy, you can go through a bone marrow transplant, and we're also going to give you some time to drink some kale smoothies and do some meditating and crush up the almond kernels and go to Tibet and bang the gong. And unfortunately, you don't get that time. No. You don't get those choices. But what would be really cool would be the young woman or the young man that comes in from New South Wales government from health, who's probably 2nd or 3rd year out, and they're looking at their textbook thinking, how the hell am I going to handle this 54-year-old, 53-year-old emotional woman who's been given an incurable cancer diagnosis, and all they're waiting on is, okay, she said this, I'm going to say this next. This is how it feels.
Yeah.
No disrespect to any of those people.
No.
That'd be a tough gig.
Oh, absolutely. Giving someone that news.
But imagine,
they switch off their emotions. And you said that emotional intelligence isn't always there, but it's what they have to do to protect themselves.
In their mid-20s. Talking to a mature woman or a mature man who's got a lot of life experience and children. And it'd be great to have the red book and another book, and saying, this is not about a book about cure. This is a book about healing. And you can heal in many ways, even while, God forbid, you're dying. But we're all dying, really.
Absolutely.
But so healing is around not necessarily acceptance, but it's finding that level of peace amongst the craziness and the chaos of what's going on. So that it's that being able to remain calm, in this case, the chaos of cancer. So
it's that calm after cancer, isn't it?
Yeah, if you can know that there's something coming up and not getting caught, not what we call crossing the bridge before you have to, like that bridge, we don't know what's on the other side.
No.
So why would you cross it until you have to? From an emotional perspective, from a curing, from a treatment, from a healing perspective.
It's so powerful, isn't it? When you say the word healing, like you said, it's not about, I'm going to go and try this miracle thing because I have to have a cure to feel healed. It's about healing emotionally and healing the pain so you can make every day count. So that you can find that level of serenity. That's what the Serenity Project is, isn't it?
It's all about. It's just wherever you are and whatever's going on, being at peace around where you are in the middle of what's going on. It's not meditating. It's not finding my chakras. And those things are all cool. Like
whatever works for
I've done a bunch of that stuff, and it was at the time it was fantastic. It's about just allowing yourself to be at peace and being, some people call it, there's mindfulness, there's being present. It's more than that. It's that as well. It's an interesting thing.
And I think driving a project like that and spreading that around the world is an amazing legacy to leave, whether it's 10 years, 20 years, 50 years down the track, it doesn't matter.
I think, and not everybody's going to get it,
No.
which is okay. What would be, I think it's about having the awareness, or being aware to have the awareness.
Yeah.
That would be, imagine that. That'd be cool.
How cool is that?
Yeah.
I mean, it's absolutely a movement. And it's about that ripple effect, that power that the Serenity Project can have. So I'm really excited for what lies ahead as you start to roll this out. And I'm going to put that link in the show notes for the listeners, because we would absolutely love to have you on board for the Serenity Project, which is launching soon, and that'll be in the show notes and updated as soon as everything becomes available.
Yeah, well, I'll be in the background supporting Bron. Yeah,
you will be, as you always are.
Yeah, that's it.
And thank you so much.
No, it's been good. They're really good questions to be asked, and thank you. Thanks for being you.
Thanks. We love you, Paulie. You know that. We love you guys so much. And honestly, this is about getting raw, real, and vulnerable, and really highlighting how important the people behind the scenes doing all the caring and really carrying the load, making sure that they're seen and heard as well. So thank you. I really appreciate it.
You're welcome.
Thank you.
Thanks,
Bye
guys.
for now. Thank you for joining me in this episode of Growing Tall Poppies. It is my deepest hope that today's episode may have inspired and empowered you to step fully into your post-traumatic growth, so that you can have absolute clarity around who you are, what matters the most to you, and to assist you to release your negative emotions and regulate your nervous system so you can fully thrive. New episodes are published every Tuesday, and I hope you'll continue to join us as we explore both the strategies and the personal qualities required to fully live a life of post-traumatic growth and to thrive. So if it feels aligned to you and really resonates, then I invite you to hit subscribe, and it would mean the world to us if you could share this episode with others who you feel may benefit too. You may also find me on Instagram at Growing Tall Poppies and Facebook, Dr. Natalie Green. Remember, every moment is an opportunity to look for the lessons and to learn and increase your ability to live the life you desire and deserve. So for now, stay connected, stay inspired, stand tall like the tall poppy you are, and keep shining your light brightly in the world. Bye for now.